I've been working in cystic fibrosis since about 1989, but in this job for about the last 22 years. So for everyone that's been through Westmead Children's, I've watched them being born and grow up and move to adult care, which has been very nice. What I'm going to do today, rather than just talk about what we do at Children's Hospital, which I'll talk a little bit about, I'm more going to talk about what transition is and some background behind it, like what the process is. Being this concerned about transition to adult care is a really nice problem to have, basically. It wasn't always something that got a lot of attention at CF meetings, and certainly wasn't something that got a lot of attention when we were first meeting families, and certainly in the early years of my job wasn't something that we focused on for a few reasons. One of the reasons was I was the paediatric and the adult CNC, so transition was really easy when that was the case. But secondly, like going back 18 years ago, 20 years ago, when we were meeting families, we were positive about children with CF's future at that time, but we knew that there was a lot of things we had to do along the way in those next 18 years before we worried about moving on to adult clinics. But now, really, we talk about moving to an adult clinic when you're 18 in that first 2 days when we're meeting families. And for most kids now that we meet, we're not going to be their longest term care providers. They're going to get more care in an adult hospital than the 18 years that they're going to spend with us in a children's hospital. This graph, if you can see it very well, the years along the bottom are from 1998 to 2012. So it's a 15-year period, and the number of adults with CF in that 15-year period increased from 25% of the population to 50% of the population is now an adult with CF. CF was always put up there as a model for these things, and we were in a really fortunate position because, unlike a lot of chronic illnesses, by the mid-2000s we had really well-established adult clinics with teams, which was unheard of in a lot of other illnesses. And there's been certainly physicians and individuals interested in CF in adult care ever, but by the mid-2000s they had teams that were really the same as the teams that are available in children's hospitals. They had nurses, they had physios, they had dietitians, they had access to other specialties that are needed in CF, like gastroendocrinology, all of those things, exactly the same as we have. So CF was really put up there as a model, and we've been very lucky. And certainly the most important message is really that we want to try and get it right for the individual. Like, transition won't always look the same for every single person that walks through our clinic, and it's about getting it right for that person and that family at that point of their life. And everybody will be different and need slightly different things. Some people need lots and lots of time spent with them in order to get all the services right and for them to feel comfortable, and other people are much more savvy and confident and have less needs. Some people obviously have a lot more needs and have more health issues at that sort of 16 to 18 year time in their life than others do. So different people have different amounts of needs. So transition is a purposeful and planned process that addresses medical, psychosocial and educational needs of the adolescent with a chronic medical condition as they move from paediatric to adult care. And the important part of that definition is that it's a process. So transition is not something that happens, it's not an event. It's not the day that you move from the paediatric hospital to your adult hospital. It's something that happens over years and years, and often you won't realise that what is happening is transition. So there will be periods of time as your child is growing up that staff in the hospital will start doing things like, what medications are you on at the moment, John? And getting John to tell them what they're on. And do you know what you're using those medications for? Or they might start showing them their graphs, their growth graphs, their lung function graphs, those sorts of things, and going, look, that's fabulous. Look how much weight you've put on this month. What have you done differently this month that might have caused that? And all of those kinds of things are starting to get your young adolescent a bit more in tune with their health and maybe thinking about some cause and effect kind of things. And all of those kinds of things are the early parts of transition. You know, do you know what that medication is and what's it for? And it's really important, and I'll talk a little bit more down the track, for parents to know the answers to those questions too. And the other important part about saying it's a process is it also doesn't stop when you move to the adult clinic. It's meant to be a process that we spend maybe 4 years or so doing, but then there's also a phase out period of that process. There's a transfer that happens when you transfer your care officially from your paediatric hospital to your adult clinic, but transition needs to continue and families remain involved, and I'm sure Lucy will talk about this, and they do, and it's a continuous process for several other years until everybody's ready for that to stop. And for some people it never does really stop, that process. These are the tools that we use at Westmead Children's loosely to guide our transition process, and they are broken up into kind of 2 stages, and most people do this. There's like the early stages, which the ages that you're looking at are kind of, our tools say 14 to 16, but a lot of places would say more like 12 to 14, 15, 16, that you're just starting to do the things that I was talking about. You know, what are your medications? Do you know what they're for? Like just maybe one like new little thing at each clinic visit that we would start to do. We're also at this stage starting to at least think about and getting parents to think about letting us see their children for a little while on their own. And what's really important is for families to be able to start to let their kids answer the questions we're asking them. Like sometimes we'll ask, "Hi Johnny, what, you know, how have you been since we saw you last at clinic?" And from here, come on, answer from mum. Like, so things like that, just starting to allow, just give them a little while. We still want to know what you think happened in the last time since we saw you at clinic, but just to give people like your child the opportunity to start answering for themselves, to give them the opportunity to start engaging in clinic rather than being somebody that sat on a chair with their iPad like we expect that the little kids will do. We don't expect the really little kids to sit and listen to us, but as they start to get older, for them just to sit and listen to what the doctor's saying, what the conversations are, those kinds of things. And then the next sort of stage at that 16 to 18 stage is much more about trying to teach bits and pieces about your illness and about specifically how it's affecting you, starting to look at things like genetics, starting to look at things like navigating an adult system and those kinds of things. But we need to remember that not all patients will be able to take all of this in, or not all people with CF will be able to take this in. They're teenagers. There will be a big variation in how much they're willing to take in at that point in time. Like some teenagers are very interested in their health and what they can do to improve their health and those kinds of things. And some teenagers do not want to know anything about it. And that's part of the individualisation of it all. We need to just go, well, if that's where they are at the moment, we need to work with that. And it might, you know, tiny little chipping away baby steps for people like that. And not everyone's going to move through the process at the same speed and in the same way. You can do a lot of this sort of preparation work at home as well, with starting to encourage your child to learn how to look after their nebulizer equipment. From really little, they can start learning those kinds of things. Start, you know, talking to them in the right terms, like instead of, you know, take that white tablet for me today, start teaching them. And I can't tell you the number of families that will ring up and go, "Oh, we've run out of the white tablet. And what is it for? What do you want it for?" Like, if their parents are calling it the white tablet, the kids are never going to learn that that's Augmentin and I'm on that because I have a chest infection. Like, so it's really just starting to use the right words at home as well. Another principle of transition is really ensuring that the adult team is aware of your child as an individual and where they're at. And so we have really, over the last few years, started, I think, communicating better with the adult teams in terms of We have sit-down face-to-face meetings where we'll have paper handovers of every child that's going to all the different adult clinics in New South Wales. We'll go through, we'll bring up all their charts exactly the same we do every year when we do an annual review on your child and get a snapshot of their health. We'll do that with the adult team and take them through, these are the treatments that we're using for them and they worked because of this didn't work for this child. So they do have an idea of where you've been, what you've done, and then they'll sit down. The adult teams have been great in coming down to Children's Hospital so that they can have a face-to-face meeting with your family and child, with the adult team and your paediatric team in the same room and you, so that you can have a conversation about what's worked for you, what doesn't work for you, and they can explain to you what adult care is. You can look at adult care really as getting a fantastic second opinion because really you've had the same doctor, most people, for 18 years, and it can get a bit stuck in a rut and we miss things and you can, things that we haven't thought of to try with your child. You've got a whole new doctor who's extremely experienced in looking after adults with CF that have more complications than 90% of children with CF that can offer opinions on improve. There's got to be positives and advantages to that. Second opinions are never a bad thing. There are 3 adult hospitals in New South Wales that look after people with cystic fibrosis. And just like when we meet a new family and get a new baby, you get given a doctor and you may or may not gel with that person. And just as in Children's Hospital, we at times will move patients from doctor to doctor, and we certainly have children that move from clinic to clinic because they have not had the experience they wanted where they were. The same thing happens in an adult hospital. So we help you choose an adult hospital. We give you information about each of the hospitals so that you can choose what you think will be best for your child. And normally people do it on your geographical location or where your child's studying, which makes the most sense. But, it may or may not work out for you. And so there are options. There are other adult clinics if your initial clinic hasn't worked out the way you might have hoped. But I always say to people, try and give it at least 6 months, more like 12, because you need to give those sorts of relationships time to grow and you need to give people a chance to explain what their decisions are and see if that's going to work for you. So it's not sort of a turn up one time and go, don't like him, let's try the next, because there's only 3. He'll run out pretty quickly. But ultimately, transition is aiming to empower, encourage and enable your teenager to look after their own CF, look after their own health care and be able to move to an adult clinic with some sort of idea about their own body, what's working for them, and have enough confidence to be able to relay that to their adult team, pretty much. I find them really hard to work with. I am much more a small person nurse, but they, as much as they don't give you a lot, but a lot of them are much more resourceful than we actually realise, and they will leave us and they've not been giving us anything and we think they don't know anything and it's like, oh my goodness. But they get up to the adult clinic and they actually do know it and they can relay it and they talk really well to the adult staff because they're used to talking to young people much more than we are, like young adults. And so I actually find the transition process in teenagers difficult and awkward. I'd much prefer my under 10s. It works out in the end. If you're feeling nervous, I think that's the best thing to say. Kids, families and support networks are vital in making transition work well. Just being with them and making sure that you don't expect that they are just going to pick up everything and do all of their own care, because sometimes we certainly see and we hear from families that go, well, they're 14 now, and so I'm not reminding them anymore to do their nebulizers. Like, well, won't always work like that, because maybe for the year that they're 14 to 15, they're being really motivated and positive, and then from 15 to 17, they're like, I'm not doing anything. So people need their parents in their CF care just like people need their parents in every part of their life, varying amounts at different times as they go through. So while we want to encourage independence, and there's all this, make a child independent, they're not always going to be independent. And sometimes you will need your parent to come back in your life and go, okay, well, for this month, because you're clearly just not buying into your CF this month, I'm going to do your nebs, or I'm going to have to put your crayon back on the table in front of your plate, or whatever that might be. So just, like you would with every other part of your child's life, be aware of where they are and how they're feeling at that point in time. Keep yourself educated about CF as much as you can. There's so much change. I'm constantly trying to keep up with it. So if you can keep yourself educated and talk about CF at home like you talk about everything else, to help your children remain educated, and talk to them in terms of, on the way home from clinic, that was great weight gain. What did we do this month? Have those kinds of conversations. Or, your lung function's dropped off a bit. What haven't we done this month? Whatever it might be, just include it as part of your normal life in having those conversations as well. And just, I think the other really important thing is trying to foster in them early a sense of self-confidence, and that they can do things for themselves. So, for example, as you might say, can you run into the shop and buy the milk once they're sort of, I'm a bit of a parent, so I started doing that at about 6. Go and order your own McDonald's at the counter, whatever. In clinic, you can be doing things like go around to pharmacy and see if your medication's ready. You can send your child to the desk and get them to make the appointment for their next clinic, so that they can start to see what the processes are and start to realise that this will be what I need to do once I move on to an adult clinic. Really, by 18, by the time your kids have finished their HSC, they are ready to get out of Children's Hospital. They have had enough of being around small children. They've had enough of people forgetting that they're actually basically an adult and talking to them like a child. Almost all of them, I really don't these days see the kids going, I don't want to go. I see the mums and dads saying, I don't want to go. So it's going to be all right. When you get to the adult clinic, they are still going to involve you in your child's care or your young adult's care. They will still allow you to do the kinds of things that you have done with us. They do have absolutely everything now that we have in a paediatric clinic. They do have the full team of very, very experienced staff that can provide all the same things that were provided for your child at Children's Hospital. There are the differences, which Lucy will talk about, is money and funding perks, because kids, get more money. Not CF, but just in general, because children are cute.